Hello all. Today we are going to explore a very important and commonly used modality in physiotherapy, that is cervical traction. This is especially relevant for patients suffering from neck pain, nerve root compression and cervical spinal issues. Yes, let's begin with the basics, cervical anatomy. So, to understand cervical traction, it is crucial to review the basic anatomy of neck. So, the cervical spine consists of 7 vertebrae from C1 to C7. So, between each vertebra, there are intervertebral discs that acts as shock absorbers. So, these discs maintain spacing and flexibility. Also, from the sides of these vertebra, spinal nerves exit through openings called foraminae, and these nerves travel down to the shoulders and arms. So any compression in the cervical region can affect sensation and function in the upper limbs. So, what is cervical traction? So, defining the modality. Now, what exactly is cervical traction? So, it is a therapeutic technique where controlled pulling force is applied to the neck. This helps to decompress the spine by gently separating the cervical vertebrae. So, what does that do? So, it relieves pressures on the nerves, it reduces pain, and it improves the blood circulation and mobility in the neck. Yeah. So, what is the types of cervical traction? There are two main types of cervical traction. One is manual traction and the other one is mechanical traction. So, the manual traction, this is done by a therapist using their hands. It allows for better control and adjustments. It's usually used in acute cases where the therapist needs to respond quickly to the patient's feedback. Whereas in mechanical traction, here machine applies the force. This is useful in chronic cases because it delivers a consistent and sustained pull. Machines allow settings. Force, duration, and angles as well. Yeah, what are the indications of cervical traction? So, what do we use it? When do we use it? So, cervical traction is indicated in many clinical scenarios. For example, herniated disc, radiculopathy, osteoarthritis, and muscle spasm as well. So, in herniated disc, it helps to reduce the pressure on the spinal nerves. Whereas in radiculopathy, that's when a nerve root is irritated or compressed, causing radiating pain. Whereas in osteoarthritis, traction increases the joint spaces, providing relief. Whereas in muscle spasm, it helps to relax the tight muscles and improves the blood flow. So it is not just for neck pain, it can also help with the pain radiating to the arms as well. Coming to the contraindications and precautions, however, cervical traction is not always safe. So, some of the contraindications are also present. So, they are severe osteoporosis, that is, weak bones that may fracture very easily, and spinal tumors, that is, traction might worsen the condition. Whereas in pregnancy, in which the hormonal changes can loosen the ligaments and stuffs, and traction may strain the spine, and in acute injury or infection cases, which it can aggravate inflammation or spread infection. So always screen the patient thoroughly before starting the traction which we are providing to the patients. So these are the contraindications and precautions that should be taken before providing a cervical traction to a patient. In short, it is nothing but coming to kind of conclusion, it is nothing but one of the contraindications are severe osteoporosis, spinal tumors, a pregnancy, and acute injury or infection, anything, since it causes inflammation and spreading infection to the nearby areas, it is completely contraindicated. Yeah. So, how it is applied? So, for effective treatment, technique matters. So, the first thing is the positioning of the patient. So, the patient may lie supine or sit. Comfort or proper neck alignment must be very crucial. Whereas the second one is traction force. So, initially, we'll be starting very gradually. The force with a minimal range, and to the extended range gradually. So increase force based on the patient's tolerance level. So duration and frequency, coming to duration and frequency, it is nothing but usually 10 to 20 minutes of duration, around 3 to 5 sessions per week will be given. Whereas while looking upon the reassessment, monitoring patient response after each session. So if the symptoms getting worsened, we don't continue the treatment. So yeah. So, what are the adjuvant therapies and patients' education? So, it is nothing but cervical tractions work best when combined with other therapies as well. So, the first one is the stretching and strengthening exercise of the neck muscles. If combined with the cervical traction, it not only relieves the pain of the patient but also strengthens the muscle of the patient.